Chronic pelvic pain is a sort of generic umbrella heading term which encompasses a lot of different types of pain. The cause of the pain can be directly attributed to gynecological causes, it can be attributed to urological causes, it can be attributed to problems within the nervous system, or all too often there can be no specific identifiable cause found. And that causes quite a lot of heartache and angst for people, because if you don't know what's wrong with you, you often believe that there can't be a treatment or management plan sought for it. When ladies have problems with pelvic pain, they can often have a big impact. This can often have a big impact on your ability to work. It can have an impact on your ability to perform simple day-to-day activities such as shopping or cooking or cleaning, or indeed even doing the general stuff that we all like to do on a day-to-day basis. And it can have an impact on individual functions of our body, such as urination and defecation, and it can have an impact on ability to exercise or even have intercourse. And of course that all has a knock-on effect on relationships thereafter. And so one of the things that's really important when you have chronic pelvic pain is to be able to have an individualised assessment to specifically understand the areas of life that the chronic pelvic pain has an impact on, so that an individualised treatment plan specific to your needs or your chronic complex pelvic pain can be understood and planned. It's important to know that about 90% of women report pain with their periods or dysmenorrhea, but most of the women who suffer from this, it is sort of fairly mild and can be treated with simple painkillers like paracetamol or ibuprofen. Studies show that up to 25% of women have severe pain with their periods, severe dysmenorrhea, to the point that they can't function normal daily activities. And that has a huge impact on life. And often the pain is not just focused around about the menstrual cycle. When someone actually bleeds, it can sort of elaborate out to most of the month. I think it's important to understand and realise that just because there isn't a specific cause identified for pelvic pain, doesn't mean that there are no treatments available for it. A lot of our treatments can be quite generic, and a lot of the time we can come together with a treatment plan despite the fact that there is no individualised specific diagnosis for the pain that someone experiences.